Good afternoon. Welcome to another episode of Fertility Talk. And as I mentioned before in our previous talks, we are not celebrating, but we're creating awareness out around Reproductive Health Month, right? And we are talking to Dr. Coetsee, and he is from Vitalab KZN. So welcome, Doctor, and thank you for joining us.
Thanks so much, Leanne.
Thank you. So today we're talking about how long will it take me to conceive? And we're going to jump right into the first question. And it's what factors influence how long it takes to conceive naturally?
Yeah, Leanne, that's a very loaded question, and that will keep us very busy for a very long time. But we normally, when we assess couples, we break it up in two. Obviously, it takes two to tango, so there's a male and a female. So it will depend on a few factors. So first of all, is it your second baby or third baby, or have you never ever conceived? Because I think that will also put your mind a little bit at ease if you've had a baby before, and if it's your first one, you'll be a little bit more worried. If we look at the male, obviously age is a problem, or can be a problem. We can talk about that a little bit later as well, but the male that's 40 years and older, obviously the effect on the male is not as bad as on the female, but it can also play a role. So what we see in practice is obviously our males that are in the gym, the testosterone levels that started going down a little bit, the muscle mass is going down, so they go and see their GP or sometimes even their urologist, and then gets prescribed testosterone, which is obviously a big no-no for fertility. I think to know what other factors will affect your chances is to step back and say you need to be fit and healthy, have a good diet, not be overweight, be careful of any outside medication that you use that can affect your fertility. And if you are able to have an erection and keep that erection, then everything should be fine. Obviously, a quick sperm test with your fertility clinic will also give you lots of information that will actually take all of those factors all together, because that's the end product that you are looking at. That's on the male side. Obviously, the female side, a few more things to look at. Again, the healthy lifestyle is important. Make sure that you ovulate. If you know that you've got underlying conditions that can affect your chances of falling pregnant, that may be endometriosis, you've been diagnosed with it before, or you're not ovulating regularly, all of those things can affect your chances of falling pregnant, and then maybe seek help a little bit sooner.
Okay, thank you, Doctor. Our next question is, at what point should someone be concerned about the timing it's taking to get pregnant and seek medical advice?
Yeah, it's our classic definition where we say if the female partner is younger than 35, we normally allow you to try and fall pregnant for a period of 1 year. And if you're then not pregnant, then you need to seek the help of a specialist. Obviously, if you're older than 35, we do get a little bit worried about egg quality and quantity, and therefore after 6 months of trying, then consider seeing your specialist.
Okay, great. Our next question is, how does age impact the timeline for conception for both men and women?
Yeah, so we've touched on it a little bit. Like I've said, age is far more important in women. And we know that for women, they are born with all their eggs in their ovaries. There's a constant reduction in eggs quantity from birth, from going into their menarche, when they start their menstruation, etc. And from the age of 35 onwards, that actual decline becomes quite significant. So from the age of 35 onwards, egg quality as well as quantity becomes a big problem for our ladies. So that's why I say, like, you know your HIV status, you must also know your egg status. And there are some blood tests that you can do to know how many eggs you still have. And that's called the anti-Müllerian hormone blood test, which is very easy to do. And it's fairly consistent, whether you're on the pill or not, what time of your cycle, it does not interfere with it. Yep.
Sorry, did I break your word there?
Yeah, no, and then just in terms of men, so we know advanced age in the man can also become a problem. The only problem is we don't know what age is advanced for men. It's not clearly defined as it is for women 35 and onwards. But it looks like age 40, 45, we know that the embryo quality starts getting affected by the sperm as well.
Okay, perfect. And then our next question is, what lifestyle changes can improve the chances of conceiving more quickly?
Yeah. Also touched on that a little bit. So, live healthily, by that we mean have a good diet. Again, there's no specific fertility diet. I think that will make that huge difference. Obviously, there's lots and lots on social media about diets, but I think reduced calories, a healthy diet, lose some weight. We know if you, for example, suffer from polycystic ovaries, if you can lose 10% of your body weight, that will help a lot in getting you to start ovulating spontaneously, which is all very good. Also, to lose weight before you fall pregnant is important, because you're less likely to have problems during the pregnancy with sugar management, etc. Big babies end up with cesarean sections and everything else. So healthy lifestyle, weight loss, make sure reduce your alcohol intake, make sure that you take your folic acid well in advance, at least a month before you start conceiving. Make sure that you're ovulating and that your periods are not too heavy and not too painful. On the man's side, exactly the same what we've discussed. And then make sure that you have regular intercourse, and time it correctly, meaning around the time of ovulation. If you do an ovulation test, that's the time to have intercourse as soon as you see the smiley face, and for the next 2 days after that. That way you'll be able to time it properly.
Okay, thank you very much, Doctor. Our second last question is, are there specific medical conditions that can delay conception, and how can they be managed? So it's a very broad question, but maybe you can just break it down smaller, shorter. Yeah.
I think on the male side is the testosterone use. We see patients every week in the clinic that has been put on testosterone, because the doctor says, listen, your testosterone levels need to be normal for you to be able to have sperm production, and we know it's not the case. Yes, it needs to be normal, it needs to be normal, but you need to produce that testosterone by yourself in the testicle, not get it from an external source. So I think on the man's side, it's the testosterone use. Females, obviously there's lots of things. It is endometriosis, and that's also something that we see very common. And please, I think you have to, as a patient, speak to your gynecologist, to do a second or a third endometriosis surgery on you when you can't fall pregnant is not indicated until proven otherwise. What I mean by that is if you don't fall pregnant after a previous laparoscopy, please do not let your doctor say, let's go and have a look again. Maybe there are a few spots of endometriosis and so on, especially if the endometriosis are on your ovaries, because every time the doctors, we as well, sometimes we have to treat endometriosis, try and remove a cyst from the ovary, we cause damage to those ovaries. And that is where your AMH, the blood test I referred to previously, will start dropping. And if you want to do it, your laparoscopy, let your doctor do an AMH before the surgery and repeat it again after the surgery. And then you'll be able to see what effect that has. The other thing that we see, obviously, are very common is polycystic ovaries and not ovulating regularly. So lifestyle changes like we've discussed, as well as ovulation induction may from time to time be necessary, where we stimulate those ovaries to try and produce eggs so that your lining can build up sufficiently for a baby to be able to implant and then to return to regular cycles, because you can't have regular cycles unless you are ovulating.
Thank you. Thank you very much, Doctor. Our last question is, when should someone consider fertility treatments if they are struggling to conceive?
Yeah, I think there, if it's your first baby and you've tried your 1 year and you've seen your gynecologist and they've done the initial testing, and that would be do a sperm test, test your tubes by doing a dye test, the HSG, and made sure that you are ovulating and you are having normal hormonal profile, then it's unexplained. And I think that's a good time then to search for some help at your local fertility clinic.
Okay, thank you very much. Was there anything else you wanted to say?
No, I think that is very short and sweet.
Yeah,
Obviously, I think it is a very difficult subject to discuss in 10 minutes.
yeah,
I'm sure if you give this question to AI and ask how long will it take, I think it will be 3,000 pages. So
yeah,
I think our doctors will not be out of work very soon, because
yeah,
each and every patient is different.
yeah.
Each and every couple is different, may need something different to help them to fall pregnant.
Absolutely. Thank you very much for mentioning that. And we always try and say, like, you can't, someone will message and say, or email and say, I'm not falling pregnant. Why? And I'm always saying, please, please go and see a fertility specialist. I can't, first of all, I don't give advice to anybody. You need to speak to a specialist. But I can't say, yes, take that medication because that is going to help you, because it works. Everyone is different. So everyone's problems is different, and you need to see a
Correct.
specialist for that. So thank you very much, Dr. Coetsee. I really appreciate your time today. And yeah, we'll see you again, hopefully soon. Thank you very much.
Thanks,
So
Ashley.
thank you. So if you want to get hold of Dr. Coetsee, he's at the Vitalab KZN, and you can contact, you can actually go to their website, it's Vitalab KZN or Vitalab dot, is it co.za?
No, .com.
.com, yes, vitalab.com. And you can always go visit them. They're on Instagram and Facebook. So you can contact them that way. And you can also just DM me, or you can pop me an email, and I will definitely put you in contact with one of the specialists at Vitalab. So thank you very much, Doctor, and have a great day.
Thank you.